Okay, I am Erica Howard, and this assessment will be on the musculoskeletal system and the neurological system. Okay, so I'll begin by performing range of motion on my fingers, wrist, and elbows. Flexion, extension, abduction, adduction, my wrist, flexion, extension, radial deviation, ulnar deviation, my elbows, flexion, extension, supination, pronation. Next, I'll do my neck, my shoulders, and my spine. Flexion, extension, right lateral bend, left lateral bend, right rotation, left rotation, my shoulder. This is also the assessment that you will perform on a patient who has rotator cuff injuries or possibly has rotator cuff injuries to perform this assessment. So this is the range of motion you will perform. Flexion, extension, circumduction, abduction, adduction. For my hip, flexion, extension, flexion, extension, adduction, abduction, interior rotation, external rotation. And for my shoulder, this is the interior rotation and external rotation. For knee, flexion, flexion, extension, and for my ankle, dorsiflexion, plantar flexion, inversion, eversion. And for my toes, flexion, extension. My next assessment will be on Mr. Howard, who has already given me verbal permission. I will check for knee instability and meniscus issues. Okay, so the first test we would do will be the Vargas and the valgus test. The Vargas test tests his LCL. The valgus test tests his MCL. So this test is performed by stabilizing the patient's leg and knee, lifting up, and the joint medially and laterally. And this is how you check that ligament. Another exam would be the anterior and posterior drawer test. I'll climb on the bed for this exam. I will bend the patient's knee, stabilize his foot with my knee. Find that knee joint. And do an anterior draw, posterior draw. And the anterior checks his ACL, posterior checks his PCL. The next examination for the knee, to check the meniscus, will be the McMurray's test. And with the McMurray's test, the patient's leg is straight. You stabilize the knee here, lift the patient's leg, bend, go out kind of like in a circle, feel and listen for pops or cracks. Okay, and that concludes the knee exam. So the next exam we'll do for this patient, if you'll sit on the side of the bed, will be to check for carpal tunnel. I'm sorry, I thought you were going to kick me. Carpal tunnel exam. So there are two tests that you test for this. It's the Tenson's test, and the first test you would extend the patient's arm, have them have the palm up, and tap here, where the medial nerve meets the wrist. If he complains of numbness, tenderness, or pain, he could possibly have carpal tunnel issues. The next exam would be the Phalen's test. And with the Phalen's test, the patient will lift his arms here and leave them in place for about 60 seconds. If he complains, like that. If he complains of numbness, tenderness, or pain, possibly has issues with carpal tunnel. So We got carpal tunnel. Next, we'll do rotator cuff exam. So we've already performed the range of motion for this exam, so we won't repeat it. Ooh, almost fell. So the first thing we will do is, excuse me, I'll palpate his 6 muscles. For any abnormalities or pains or complaints of pain or tenderness. The first exam we would do, or test that we would do, would be the Alley's stretch test. And we'll have the patient to reach above and below like this and stretch. And you will note how far they can go through your go below. See how big gap. And the other side, he does have an affected arm. Here, stretch, and here. Okay. So another exam we could do for him is strength against resistance. So I have him to turn this way, bend his arm, palm up. And I'll apply a little resistance here and have him to flip his arm. I'll let him do it. So that's another exam. And he would complain of pain or tenderness or numbness during that. The next exam is the drop arm exam. So we have him to lift his arm at a 90-degree angle. Try not to go past 90 degrees because anything above 90 degrees, he'll use his brachial muscle to hold his arm in place. A positive test would be if he were to just drop his arm. Sometimes if you notice the patient leaning forward, they're probably using other muscles to keep that arm elevated. So from this exam, we'll move to the scoliosis exam. So we have the patient to turn around. We will assess and look at his back for symmetry, look at his shoulders, check the clavicle wings for symmetry, as well as his iliac crest and his gluteal fold to make sure it's all symmetrical. I also palpate or have the patient to lean forward and trace the spine with my fingers. If you note any curvatures, could possibly mean that the patient has scoliosis. And here's his spine. Here's his spine. So we will go from this exam to the lower back exam. So if you'll first, before he hops in the bed, I'll palpate his paravertebral muscles and ask about pain or tenderness. Any pain or tenderness?
No.
Okay. So we'll have him to lie in bed and we'll do the straight leg and the cross leg test exam. Okay. So with the straight leg test or exam, patient's leg is straight. We'll have him to lift it to the point that he says he has pain. And if he complains of pain, I would just release some and then dorsal flex. But he didn't complain of pain. So if he had a positive test or positive nerve issues, he would have a shooting pain down his leg or pain or numbness in his back or legs. So we'll do the same thing on the opposite leg. And this also is the cross leg test. So lift and dorsal flex. All right. Okay. So we've performed the lower back test. The next exam we'll do is the meningeal exam while he's in this position. And the first test is called the Broditsky's test, and that's when we'll have him to touch his chin to his chest. So you just have him to flex his neck. Any pain, numbness, discomfort in your neck?
No.
Okay. The next exam is the Kernick's test, and this is not a definitive test, but this test is also been linked to people that have meningitis, but it's not a for sure test. You have the Kernick test, you have the patient to flex their leg, and they will complain of pain or discomfort. The next exam would be the Broditsky's exam, which is a normal finding in children birth to 2 years old, but over the age of 2, it's not a normal finding. For an adult, he should have no reaction to his toes or maybe a slight flex. in a positive test, he would have the fanning of the toes, so the toes looking more like this. So you basically just come here and draw a J, and he has no response. So that's good. So now that we've completed those exams, we'll move to our our DTRs. So if you would sit up, Mr. Howard. Oh, let me get this out. So we'll be testing. This is a neurological test, and with we'll check his supinator, brachial, supinator, bicep, tricep, knee, and ankle. Supinator is C5 and 6. Bicep is C5 and 6. Tricep is C6 and 7. Knee is L1, 2, and 3. Knee is L1, 2, 3, and 4, and the ankle is S1. Okay. So the normal response will be a small jerk. We will try. And here we will have him to bend just so we can find that tendon. And you never percuss over the brachial tendon. But a normal reaction will be a little.
It jumped one time.
Oh, it did? Okay. And here for the tricep. And then we'll do the knee. I don't know if you want to stand in front of them like that. All right, and then the ankle. Well, you need to relax, but it's hard to relax when he's, hanging on the bed. I should have probably been in the chair, but that's fine. So those are the DTRs. So the next exam we'll do coordination. And for coordination, we'll have him to walk. So it'll be the gait test. So Mr. Howard, if you walk and when you do the gait test, just note if he's swaying from side to side, if he has normal gait. Okay? And when you come back, do heel to toe. Heel to toe. Wait, you're going too fast. Heel to toe, you're going so fast. Heel to toe, good. Okay, and another exam we have him do walk on his tiptoes. Okay, good. And his heels. Okay. All right. So you can have a seat. So the next exam we will do for Mr. Howard will be the rapid altered movement. And we'll begin by his hands in his lap and have him flip over like this. Rapid alternation movement. Okay? Rapid alternation movement. And the next exam will be the thumb to finger. And we have him speed up every time. All right? And the next one will be his nose to my finger. So nose to finger. He's going faster than ever this time. Okay? And next will be nose to finger. Yeah. Can you move up and down like that? Okay. Okay. So he's able to perform that. The next exam, the heel to shin test. Do you mind hopping in the bed just for a second? All right, and rub your heel down your shin, and you do it bilaterally. Okay, all right. Okay, if you hop up. Okay, so we've done that. let's do pronator drift. So the pronator drift test will help him to extend his arms outward with his eyes closed and see if he shifts or sways from side to side. He's not. I also apply some pressure to his arms and see if he's able to lift his arms back to that same position. Good. And he's able to lift it to the exact same position. So, pronator drift. Now we'll do some sense exams. Sensory exams. Perceptual sense exams. Can you sit down, please? So, okay. With this exam, I am going to start by having the patient to close his eyes. I'm going to strike my tuning fork and let him tell me where he feels it. Okay? So let me know you feel it.
I feel it. I feel it. I feel it. I feel it. I feel it. Feel it. Feel it.
Okay, good. Oh, I also have to go down.
Feel it. Feel it. Feel it.
Good. So the next exam for sensory, while his eyes are closed, he'll let me know when he feels something sharp or dull. Ready?
Ready.
Oh, sorry.
Sharp, sharp, dull, sharp, dull, sharp, sharp.
Okay. All right. And the next sensory exam we will do while his eyes are closed are the stereognosis. I'll have him to hold an object in his hand and he'll tell me what the object is.
A key.
Are we still recording? Because the light went
Yes.
off. Okay. The next exam that we will do is the graphonesia, and I'll write something in his hand. Can you tell me what that is?
3.
Okay, that's the number 3. Okay, so we got that. I think that's it. I hope that's it. I think that's all. Just do a circle because I don't want time to run out. I think that was everything. How much time?
18. I stopped.